My pleasure to welcome you to the first virtual community forum. We are here in sunny Tampa. My name is Dr. Morency, and I will be the moderator of this program. First of all, I'd like to thank all of you and all the community leaders who have inspired us and supported this project, particularly my good friend Jean-René Rainville, who is actually the sponsor of this program. And typical of Jean-René, is right here now behind the scene taking care of those technical and logistical aspects of the program. And to all of you, my sincere thanks for joining us online on this beautiful Saturday on my side. I don't know where you are. I know you're all over the place, and my community here in Tampa, my Haitian community, moi souhaite nous la bienvenue. N'a fait ce programme ça pour nous asseoir, pour nous partager information de virus ça qui a attaqué nous. Moi remercier nous en pile que de support que nous bannons. I'm grateful for your support. Today we're going to talk about the topic that has really occupied our psyche for the past couple of months. I'm talking about the coronavirus pandemic, or COVID-19. I think this is basically the most transformative event in our lifetime. This virus, in a short time, has forced us to confront our humanity. There are so many aspects of this big subject to cover, not only in the health aspect, but there's also the financial aspect, the education, technology, our new way of living, which are drastically changing. And we essentially want to take the opportunity today to invite anyone in the community who want to participate in this project to come in and share their skill, because we are sharing this together. All right, all for one for all. Now, since we are still deep in the crisis, we can only begin the conversation by addressing our own survival in the middle of so much suffering, death, fear, and anxiety. So today, our modest goal is really to provide you with some current and factual information about the virus as it is continue to evolve, so we can all be on the same page. More importantly, being in the medical field, we want to share with you other medical options that you may or may not have considered in the past in trying to protect yourself and your family. For those of you who don't know me, I'm a retired family doctor who has practiced medicine for over 34 years, and also in various aspects. And I'm also a former assistant professor of family medicine here at University of South Florida College of Medicine right here in Tampa. And since retirement, I have been hosting a radio show on wellness, mental health, and disease prevention. It's called Doctors in the House. It is broadcast every second Wednesday on 99.1 FM WUGM in St. Petersburg Community Radio, or you can listen to it online at www.99jamestheberg.com. And I promise you, this is my only pitch. I have no other conflict of interest. I have had the good fortune and pleasure to have with me to share this program online is Miss Lauren Fox. Ms. Fox is a certified family nurse practitioner, certified classic homeopath, and certified midwife. She brings with her 40 years of clinical experience. She's a member, educator, and clinical director of the group called Homeopathic Without Borders. She will be addressing some of the complementary aspects of alternative way of taking care of our health, especially in this pandemic. And after the whole presentations, we invite you to participate in the question and answer questions. So before I turn it over to her, let me just go over some of facts about the coronavirus, that just to refresh your memory, and again, to stay on the same page. The coronavirus really appeared in China mid-December, causing unusual and deadly pneumonia in Wuhan city in China. By the end of December and early January, China alerted the WHO Health Organization and the rest of the world. And by that time, the coronavirus had already spread, not only in South Asia, in Europe, and eventually in the US. By the end of January 30th, the World Health Organization declared that this is a global health emergency. And in February 11, they officially named the disease caused by the virus COVID-19, which means coronavirus disease 2019. And by March 11, they declared that it is a pandemic, meaning that the virus could not be contained anywhere and was spreading all over the world. Now, as you may know, this coronavirus is new, but it is a part of the family of coronavirus, which generally cause such as the common cold. You may have heard of the SARS-CoV, the severe respiratory an epidemic between 2002 and 2004, and MERS, the Middle Eastern Respiratory Syndrome, 2012 to 2015. This is named SARS/CoV. This, as you can see by now, I don't have to tell you, this is lethal, okay? And it's being classified by the expert as one of the most infectious. It spread efficiently, generally by person to person. Let me quote one of the experts who says, we are in uncharted territory because there's a lot of things we still don't know about the virus, but it spread. Okay, if you recall quickly, we had our first case in the United States on January 21st, right? By the first week of March, we had 100 cases. And at that time, nothing major happened in February. But for the last 2 months, this thing has exploded. Okay, now we are in the United States around 1.3 million cases, confirmed cases, and over 75,000 deaths, all including all 50 states. So whatever may have been told about the original symptoms of the virus, namely was fever, usually fever of 100.4, dry and shortness. Now, the new symptoms, there's a lot of variety that can characterize this virus, like muscle pain, fatigue, excessive fatigue, a lot of GI symptoms, nausea, abdominal pain, diarrhea, and the loss of taste and smell. And you may have heard in the last week, though, that the children are developing a new syndrome. Basically, it's a multi-systemic inflammation syndrome, which causes inflammation of the arteries, of the blood vessel. And that is very dangerous. And we already registered one death, but so far, over 70 kids are already involved. And this is dangerous because it can cause cardiac arrest. Here's the thing. So far, in countries that have really started early with this virus and has followed strict public health pandemic protocols, such as, them, widespread testing, contact tracing, quarantine, and who also have advocated following those control measures that we all know, washing our hands, no handshake, no hands in the face, and so on and so forth. And lately, ultimately, social isolation or self-distancing, but more appropriately, physical distancing. By implementing those quick measures on time, the spread of the virus has been mitigated in many, many, many countries. In the United States, however, the virus is still spreading like wildfire. All right, because the numbers keep going up. So here's the situations. What do you do as an individual? Okay. What if you get exposed or unfortunately get sick? What do you do? Well, personally, this is my opinion. I've realized that, we were kind of passive in the beginning, and individually, and I make sure I go ahead of the the curve, so to speak, I started my radio show on the March 11th. My message was unequivocal. Individual responsibility is crucial and life-saving. There are a lot of measures that are time-tested, such as those that I mentioned earlier, hand washing, cleaning surfaces that the virus may have landed to, and don't put your hands in your face because that's where the virus get access to the mucous membrane, your eyes, nose, and mouth. If you follow those things, you can actually help yourself, okay? And then recently, when we find that social distancing actually works in all those countries that have applied it early, there's no reason we cannot really follow this. This is the first opportunity we have in our lifetime to stay home and do other things, get involved. I do understand the situation because if you survive the virus and the economy crash or other things, so many changes that can happen, that's the problem. So, but we have to be very smart about this, okay? From a medical point of view, I spend my time as a family doctor. I train here and I know the system. Well, as far as I know, the response model we have to the coronavirus is the following. When you get infected, okay, if you are not seriously ill, you get sent home for 14 days to wait it out, and using some supportive measures, whether it's Tylenol, fluid, and the usual thing we do, drink your chicken soup and get some rest. And different people have different cocktail that they use. However, if you get very sick and you have shortness of breath, you go to the hospital for oxygen and further treatment, which may include ventilator support if your lung is failing. But in my personal opinion, that's not enough, okay? So today, one of the things we're going to do today, we're going to talk about other options, other alternative models that people can actively do. Because if you go home and you sit, you're waiting, and you with this dangerous disease in your mind, you may think that nothing is being done. But there are plenty of things that you can do. So we're going to discuss those other options today. And finally, what I'm going to do before I turn it over to Lorraine, I am going to share with you some personal experience with this virus, okay? As you know, the virus has been knocking on every door. It doesn't matter. You present yourself, the virus will take you. So in my larger family, 2 members of my family have been infected with the virus. They were working in a nursing home. And typically, they are the high-risk category. They are 2 sisters over in their 70s. They have long-term diabetes, hypertension, seizure disorder, and they are on multiple medications. So when I heard that, I said, listen, I gotta get involved. I know those people, their family, their supporters. I mean, they're really very interesting and very great friends and family members. So I got involved very quickly because I did not want them to die. Something about them said, I gotta go in there and do what I can. So I started calling them every day to make sure they were doing all the necessary things, the rest, the fluid, and because there was some issue about ibuprofen, they were taking Tylenol instead for the fever. And I wanted to make sure they were aware of some of those home remedies in the Haitian community that's been circulating online, the aloe, the ginger, and the chicken soup and different things like this. And they were way ahead of me. So I discussed what their personal physician were doing for them. Essentially, they were sent home and they were supposed to get a call in about a week. They were scared. They thought they were going to die. And so I told them, I said, listen, I just want you to know that you are loved, okay? Then if you really want to fight this virus, you can beat it. I told them, this is the time for the glass half full, not half empty. This is a time where you can forget about memories. You are living in the moment. You're doing whatever you can in the moment. I also coach them with regular breathing exercise. There's a simple exercise anybody can do, the 4-7-8 promoted by Dr. Wild. essentially you take 4 seconds to take a deep inspiration, you hold it for 7 seconds, and you expire it. You breathe out for 8 seconds, called the 4-7-8. It's something you can do anywhere, anytime, casually. And, I've practiced yoga myself, so I talked to them about all those things. Well, they hung on for a while, but after a few days, they were still alive, but very sick, to the point that when one of the sisters described to me how she felt, she's actually said to me, if I have to feel that way, I might as well die. It was painful, excruciating. So I said, wow, what do I do? And I remember a good friend, and she happened to be the current president of the Homeopath Without Borders, and she's been doing this personally herself. And she said, if you want to, there is some option. There's something you can do. And I talked to her, and then she referred me to a group who has a group of volunteers on the phone who can actually evaluate, do a consultation by phone without any charge. So I took her upon that, and that's where I met Lorraine. Okay? And I'm not going to really finish the story because I'm going to leave it to Lorraine to finish the story. So, ladies and gentlemen, it is my pleasure to introduce to you Lorraine Fox, who's going to tell us the rest of the story and what individually we can do for ourselves, especially in this time. Is Lorraine.
Thank you very much, Yves, and thank you for inviting me to do this show. It's a pleasure, absolutely. I wish I could say I was hailing from a nice warm place also, but I'm not. I'm hailing from very cold, windy Northeast. And it was even snowing here this morning. Yeah. So as Dr. Yves has said, I have been a family nurse practitioner for 40 years and a community midwife for 20 of those years. During my whole professional life, I have practiced integrative medicine. And what I mean by that is I have always known to look and felt deeply that it was necessary to look at the whole person, not just their gallbladder or their arm or their uterus or whatever was their chief complaint, that their bodily system work together. And to help people get well, you must look at the whole person. So I've always bridged the gap between allopathic, which is what I call conventional medicine, and I started learning a system of medicine called homeopathy very early on in my career. And I will talk more about that, what it exactly is in just a moment. But I'd like to also introduce the organization that I've worked with for the last 10 years, which has brought me personally and professionally to a high level of service and accomplishment. And I have been very proud and pleased to be part of this nonprofit organization that has the mission to teach and treat where there are healthcare disparities. And the organization has been in existence for quite a number of years, but I've only been involved for the last 10 years, so I'm only going to speak to what I've known and what I've contributed to this organization. Homeopaths Without Borders got involved in Haiti right after the earthquake in 2010. And as a team, we worked alongside Haitian medical professionals, and they saw what we were doing. We supported what they were trying to do. We were all working together, and we got their attention, specifically one nurse who asked us teach us this science that seems to be working so well. And at that time, we were treating people with acute injuries, deep emotional trauma and shock from what their country was going through. And they saw things turn around. So we did just that. And over the last 10 years, we have been teaching and helping set up community clinics. And there are now 51 medical doctors, nurses, pharmacists, dentists, and social workers, as well as 13 midwives who are trained in this scientific approach to the whole body and are using homeopathy throughout Haiti. And I want you to all know that. So what is this H word, homeopathy? It's a systematic science using natural medicines. These medicines are safe, they're inexpensive, accessible, and they are accessible in that you don't have to go to a pharmacy to get them. You can get them in an actual health food store. Sometimes, some even CVS chains carry some of the homeopathic medicines. And they are also very, very effective and without secondary effects, which is also a very important aspect of this medicine, and can be used for all ages, from babies on up to the elderly. So it's a very useful form of medicine. How it works is it stimulates the body's own healing capacity, basically your immune system. And to do that work, and it does that work, it helps support the immune system, which is exactly what it was designed to do, is to fight off infection, whether it be bacterial or viral or inflammation. Homeopathy can also be used to support our natural immune systems to many other physical and emotional conditions, both acutely and chronically. So I have used it in many different situations. To speak specifically to the current viral pandemic, homeopathy has been in use for over 200 years and is currently utilized on all continents. It has been shown to be very effective in epidemics dating back to those 200 years of its inception. There's lots of historical data to show that, starting with scarlet fever and smallpox and infectious diarrhea and leptospirosis, as well as this different influenzas pandemics, specifically the pandemic of 1918. So HWB's work in Haiti during the chikungunya outbreak epidemic in 2014 and the cholera outbreak after the Hurricane Matthew taught us how to mobilize systems and prevent and treat large communities during these epidemics. And so this pandemic that we are in the midst of right now, as Dr. Yves has said, has many variants and many different presentations. That's what we mean by variants. To the general public, it's many different presentations. And this is where homeopathy excels. This is how it works, is that we treat the individualized symptoms of the patient, not the diagnosis as a whole. So there is no one medicine, homeopathic medicine, for this pandemic virus. There are medicines that will help each person's individual case and how they are manifesting the variants. to bring it around to the two sister-in-laws of Dr. Yves, they had the variant that was more had to do with body aches and fever and just malaise, just feeling so horrifically horrible. They did have some coughing, but it was not based in their respiratory tract. It was more like what we think of as a generalized influenza, but ratcheted up like 10 times. So they were able to share with me their symptoms, even though they lived together. They had very similar variant presentations. They each had little differences in the way they expressed it. So that's what homeopaths do. They listen, they observe, and they treat each person's symptoms very individualistically. And that's why it's so successful. But in these instances, people need to be treated by professional homeopaths. It's not something that I would encourage people to handle themselves. And they need to be treated as soon as possible. The longer you wait, the more difficult it is to get your body to listen and go in a different direction. So a patient with a virus suffering from predominantly respiratory symptoms will need a very different medicine from somebody who has headache and body ache variant. So again, we listen to what their symptoms are. And furthermore, we go into their particular unique symptoms, such as their level of thirst, their desire, whether they desire to be still in bed, not move, or they desire to move about and might be very restless. Are they irritable, or are they mostly anxious? Are they anxious about what's going to happen to them? Are they anxious about what is happening overall? And I've treated many different people, and some of them are extremely anxious. Some of them are just lethargic and complacent, just not interested, not even able to engage. So we pay a lot of attention to those very unique, specific symptoms of each individual person. And then there's one medicine that is chosen. And what I have found in treating people during this pandemic is the repetition of the dosing needs to be very, very frequent. So follow-up is very important. So Homeopaths Without Borders has put together a response team to be available for people to call in to help people navigate through these illnesses, through this virus. And we can do it over the phone. We obviously would like very much to meet the person face to face, but that's not always possible. But because we are paying attention to the specific symptoms, we can also prescribe and treat over the phone. And we have set up a network of how to get medicines to people. There are pharmacies, there are key people throughout the country, United States and Canada, that have dispensaries of medicines. And we've been able to access those for different people, like these two women in Tampa that I treated. Their granddaughter had to drive an hour to get a medicine for them, but she did it, and it really made things move along a lot faster for them. So the follow-up, again, is very important. I probably initially spoke to these two sisters maybe three times a day for the first several days, and then I started to back off and talk to them, just check in once a day. and then as needed as time went on. And I've been trying to reach them now for the last couple of days, and they're not answering their phone. So I think they're out and about and breathing good fresh air and all that. So I think they're out of the woods.
They are alive.
Yeah, they are alive. I know that. They were delightful to work with, and they followed my directions to a T, even dietary suggestions. In terms of general recommendations for treating this virus, you need to, as Dr. Yves has said, follow your state CDC guidelines, recommendations. You want to also do things to support your immune system. Vitamin C, and I'm going to just suggest things that are pretty inexpensive and accessible. So vitamin C, vitamin D. I love the very gentle immune stimulating herb called elderberry, just like elder and berry. That's pretty accessible. You can take it several times a day, and it just keeps your immune system awake and alive and ready to go if need be. So if you do not have symptoms of this virus, this would be a good thing to be on, a good regimen to be on right now, and to keep it going while if you do get symptoms. The other important thing, and I thought these dear, sweet sisters were going to really fight me on this. They had been taking Tylenol, as Dr. Yves said, and I asked them to stop it. Tylenol and Ibuprofen are not helpful during this viral condition. Those over-the-counter fever reducers, pain reducers, they just prolong the symptoms. And they'll prolong the virus because they give you a false up and down of the symptoms. And they were very agreeable. I thought they were going to fight me on it, but they stopped. They had fever when I had first met them. And then when they stopped, within I think it was close to 12 hours. They started the homeopathic medicine. They stopped the Tylenol. Their fever was gone in 12 hours for sure, totally flat. Whereas they had fever for almost a week before I actually got to speak with them. So it is important not to take any of those. And then if you do get symptoms, please reach out to our Homeopaths Without Borders team. And as soon as possible, as soon as the symptoms do develop. And Dr. Yves has told me that he has shared that information with the group quite a lot. So
yes, you remember we had a couple of more patients
yes,
outside Florida. And then... Yeah. And they had presented with different symptoms, okay? And then the choice of remedies was also different.
Yes.
And it's just, this is when I look at those two patients, first, let me talk about those two patients, because I was, just like you, I was checking on them every single day. Mm-hmm. You know, the first, what you mentioned about the antipyretic, Tylenol and Ibuprofen, they were on that, and, you know, they would say the fever went down a little bit, but it come back again. After you change it to the cold compress, you know, they had to put one cold compress in the belly, one there in the forehead. Mm-hmm. The next morning, when I asked them, they were just like, it was like an unbelievable change. They were feeling so much better, mm-hmm. and it lowered the temperature, but they had the best sleep they had, mm-hmm. which was really remarkable. Just a simple change, okay? And the second part, the second aspect, which was intriguing, and that's why you addressed it when you talk about, one of the things I had asked them to check with you is to ask you what kind of side effect they would experience from the remedies. And you said to them, just call me if you have any side effect, which was, I think, was really clever. Because sometimes we inadvertently put problem in people's mind, you know? And they said, no, they didn't have any side effect, but they felt the initial response was so much better after mm-hmm. the remedies. Mm-hmm. Mm-hmm. And And I said, wow, what happened here? As a medical doctor, I'm just like, what is this? How does this work? Obviously, it does fight the immune system, which is obviously the answer. But
Right.
the way, the difference from all the other stuff they were doing before, and it marked a change in their symptoms. Okay, they were more confident, and also the personal attention. When somebody's sick, and you show concern, you listen to them, somewhat like sharing the burden with them.
Mm-hmm.
I always find that fascinating in my career.
Mm-hmm.
Okay? But it's not, it's just, I don't know. I mean, that aspect of reaching out to people, soul to soul, I would say, it meant so much.
Yeah.
I have argued with other folks, like, well, because we're all in the traditional medicine, we're trying, how does this thing work? Okay, because you give a dilution of something, and some people cannot even find it in the dilution, and yet it does the trick.
Mm-hmm.
So we argue about all those kinds of things. But the response was amazing, and I said, "Wow, this is amazing." So I started following them every day. So in the last couple of days, when they were not responding to you, we were talking because now they wanted to know how they can prepare to go outside or to go drive to the bank to go. It was a remarkable turnaround.
Mm-hmm.
And the other thing, so if they do not get, if they're not getting better, they need, say, traditional medical assessment. What do you do?
Okay. Well, as you mentioned, you referred to another family to me in Rhode Island.
Yes. 7 people. Yeah.
Yeah, and they were a young couple, husband and wife, who I think, if I remember, the wife is a nurse that worked outside of her home, doing home care. They're in their early 30s. The other stress, I think, for them was they have 5-month-old twins. And I think just the stress of having 2 young babies, the lack of sleep, and so forth. They both had symptoms. They both had both had high fevers. The woman had a severe headache, which went away overnight after she started taking the medicine. The husband had much more of the respiratory variant. Mm-hmm. He was laid out total. I actually never physically talked to him, which is not something I like to do. But he didn't even have the strength to be able to talk to me on the phone. And because his wife was, she was on top of it, I know, and she was right there talking to him. So it's not the ideal situation. I always like to see or talk to the patient at least. But I was able to treat him. His fever came down also overnight. It had been as high as 104. At one point, I think it was even 105. His cough was unbelievably difficult. He was having shortness of breath just getting up to go to use the bathroom. And then and he was physically, apparently, he's very fit. He doesn't have any comorbidities, meaning he doesn't have any underlying diseases, chronic diseases. He's not a smoker or a vapor or any of those things. And we got his fever down, but his cough wasn't going away. And at one of my follow-up calls, his wife told me that he had started to cough up some blood, and she had a way to test his oxygen at home, and it was dropping. It went down quite a bit just to go to use the urinal. And I, at that point, said, you know what? I am not there to be right there with you. I don't have medicines fully accessible for you. You need to get him to the emergency room.
Yeah.
And she was like, really? I said, yes, really. And she did it. And she texted me that night when she got him to the hospital. I really didn't want her to take him, but there was nobody else. She didn't want to expose anybody else.
Sure.
So she did it. And he stabilized as soon as he was on oxygen. So, I was very, worried about him, of course, but I knew we did the right thing. And it was another way to show that homeopathy can work.
That's the term. Yeah, complementary, alternative thing. Because when you have an epidemic, really, the major treatment is to prevent a complication of the disease. If you can stop the disease early on. Now, my observation about this family, those cases, is that you did prescribe a different remedy, but overnight they got better. Except for the boy, because the grandmother had some atypical, well, I won't call it atypical symptom. The grandmother had loss of taste, and then a little bit of diarrhea, and those symptoms only last one day. Yeah, there was major improvement. I mean, she was like so strong, and then you had told me the earlier we can get them to you, the better it is, so you can affect the course of the disease very early on. That was very.
He had been sick for quite a few days before I actually got to treat him, and I was happy that we were able to get his fever down, but the respiratory inflammation
was already involved. I think he had been sick for a while, for at least a couple of days. He had been.
I think it was 5 or 6 days actually.
5 or 6 days. Yeah, well, it was really great response, and
he's fine now. The whole family, as you know, are doing very well right now.
Now, you said you are you're still in practice where you are. So there's aspect of homeopathy in your practice as well.
Oh yes.
And your private practice.
Yes. Okay. Yeah. So I work. I have my own consulting practice where I see people either virtually online or in an office. I have an office in 2 different locations, and then I also function as the clinical director of Homeopaths Without Borders, and helped heading up this emergency response team that we've put together for the pandemic. Okay,
well, those 2 group of patients you're helping with, obviously you could call it 100% success. That's a total of 9 people. Now, how many other folks have you seen, say, in the last few months since this thing has been ramping up like this? And what any adverse experience you've had? I mean, in terms of
no, I wouldn't say adverse. I've probably over the last 2.5 months personally treated about 36 people with the viral syndrome. Yeah.
Correct.
And I would say this one young man that I just described, which, I get hard on myself, of course, when, I wasn't able to turn him around and prevent him from being hospitalized, but he's well and he's back up and running. That I can't argue with. There's one other woman that has had more cardiovascular variant where she's had lots of arrhythmia. She was also hospitalized just last week for potential stroke. And also a young woman with 51 and no other comorbidities except hypothyroidism. So it's shown me that this disease, like you said earlier, is not selective. It is just
anybody. Now we see the children involved in this crazy syndrome, so to speak, and some of the young people actually get into trouble as well. Yes. To me is that if you could really address this early from the front end, either by mitigation, preventions, instead of looking at the experience that they have in the hospital, because I've heard the feedback from the frontline doctors. It's so sad. I mean, people dying in front of you just like that, and that can be crippling. Now, let me ask you this though: this is not over, obviously. This is just the beginning of this, or we're in the middle of this pandemic. Like most pandemic lasts at least an average of 2 years. We don't have vaccine yet. There's no specific medications. Essentially, my question is, why is there any? Why is no? And this is going to be political because you already told me about the homeopath. Because I did share my comment with another a chiropractic doctor, which I know in town, and she actually does a lot of alternative medicine as well. And she's seeing the same response. Is those people who are victim, who are at risk and who actually die, is there essentially something totally wrong with the immune system? I mean, this would sound obvious to me. Mm-hmm. Makes them really at risk for this. For instance, obesity is one of them. Okay? Mm-hmm. And diabetes, hypertension, especially hypertensions, and people who have previous heart disease. Okay. So is this all related to the disease being aggressive? Because the disease is very aggressive, but is it all related to just the fact that they have a weakened system, a weakened body?
Yeah.
Is that your feeling?
I would have to agree with that. I look at health as health versus susceptibility. And there are people, whether it becomes from a genetic source of susceptibility or living conditions, the environment that they live in, the food that they eat, the lack of food, all the disparities that can affect health are going to affect how you respond. One responds to this virus. And then I think there's also stuff we don't know. Like, why are these children all of a sudden being affected? And it's not just children of minorities or that are growing up in difficult situations. They're just healthy children. There must be something underlying that we don't know yet.
Well, yeah, we are learning as this thing evolves, so to speak.
Exactly.
Okay. But overall, in addition to some of the recommendations we make, which is widespread, vitamin C, vitamin D, it turned out that they actually link the deficiency in the vitamin D in African American patients as one of the risk factor, to get you into trouble with the virus. And the zinc part, is there any effect on the zinc?
Yeah, no, I don't often think of zinc. It's just not in my consciousness, but it's actually been shown to be quite helpful. I've been talked to a few physicians who do IV vitamin C, and they're adding zinc to that also, and they're seeing some good results. The need for fresh air, the need for sleep, for the sun, if the sun is out in your area.
We have plenty of it. We can share.
Okay, good. Sleep, rest. I think one of the hardest things, once people start feeling like they're going to live after being treated for this, is they want to get up and go and do. And you have to rest. Sleep and rest are your best defenses.
Well, I did a show on sleep, and actually the restorative part, the where the body renew itself, it's an early sleep. If you can go to bed at 10 o'clock and then participate into that deep sleep, that's where most of the energy is rejuvenated. That's where you feel actually good. That's right. But if you keep going to sleep later, 2 o'clock, 3 o'clock, and get involved immediately into the REM sleep, you wake up as if you were being attacked by a bunch of vultures, so to speak.
So you feel like you've been beaten up.
So the idea is, with this virus, we have to learn to change our ways, not to make ourselves so vulnerable, because, God, so many people are dying with this stuff. And there's a lot of things that can be done for prevention.
Yeah. And that's one of the things that I really hope, as you said, that we're at home and we can use this time to make personal changes in our regime and in our way of treating ourselves much healthier and not taking health for granted.
Lauren, I think time is really flying here. It's almost an hour. But is anything else you want to add in conclusion? I cannot tell you how much I appreciate not only you helping with treating those patients, and they're all doing well, and for you to be gracious enough to come out and have this discussion and talk about it so that we can, and I certainly hope you out there listening that you really benefited from this. We are supposed to take some questions. Jean-René, if you listen to me, do we have some question we can answer? This is time for some questions, people to participate. One of them was infected, but I was told they were doing better. So do you have any information about the twins?
Yeah, I had a text from the mama yesterday, and she said everybody's doing fine.
Okay, so good.
The babies did test positive.
Yeah, one of them. How much vitamin D do you recommend per day?
2,000 IUs daily.
Okay. In some, it's 2,000, 2,000, 3,000, but that's the ballpark. Okay, so people are asking they're asking, can people call their hotline when they are just feeling bad and don't know what it is?
Yes. Yes.
Okay. Yes. So the answer is yes. People can call about that. Do you have the number? I don't remember it. Okay.
I have to look it up too. Sorry.
Okay. No, that's okay.
In 2 seconds.
So while we're looking for the number, let me see anything else I can answer there.
Okay. Oh no. All right. I'm going to try to get at it.
Oh, there's another question you can answer. I'm going to look for the number as well.
Okay.
Where can we get homeopathic medicine?
Okay. So again, I want to emphasize that you need to be treated by a professional homeopath for this virus, and that person would then need to direct you. Whole Foods carries homeopathic medicines. Natural food stores usually do. There are many homeopathic study groups in different states. And so the professional homeopath that you consult with would help you direct where you would get the medicine. Okay.
Now, if you're going to find a number now, we can actually post a number.
Okay.
We can post a number. I didn't really remember to bring the number right.
Okay, so it's 6. Well, can I share this? If I have it on my screen, can I share it?
Please.
Okay. How do I share? Oh, here it is, right here. Is that happening?
I don't see it. Jean-René, can you tell the...
I did.
Okay. Now it's me.
Okay. Did it share?
Oh yeah. Yes. Yeah. The number is 603-614-6012. That the Homeopath Without Border.
And there's our website at the bottom too that people might like to look at.
Okay. www.hwbna.org. Let me see again. www.hwbna.org. Okay. How much vitamin C? The vitamin C, it's about 1,000 milligram per day. Is that correct?
Yeah, I would even boost it to 2,000 during this time. But
Okay.
if anybody gets any loose bowel movement, diarrhea, they should cut back. But, generally, when you're trying to really activate your immune system, I say usually about 2,000 a day. And that can be split up in the morning and in the afternoon or evening.
Somebody asked, can you comment on the African experience with Armwise? I just heard about it, but I haven't really looked at this. Have you
Um,
heard about that? The
no,
plant,
I don't
the
know.
plant in Madagascar and Senegal.
Yeah, no, I'm not up on it to speak.
Okay, that's fine. Uh, can people call the on? Oh, that was. Can people call the online when they are just feeling bad and don't know what it is?
Yes, so that I want to just add to that. We know that this pandemic has not only created a physical condition, but an emotional, mental condition of a lot of anxiety, a lot of depression, grief. And so those folks who are feeling very emotionally, mentally affected by isolation, so forth, please reach out. And we can also help with those kinds of concerns too.
Okay. Say it out loud. What do I say out loud? Let's say it again. The number is 603-614-6012. And the website is www.hwbna.org. I hope that helps. Okay, so yes, somebody posted their hotline, so I just said it. 603-614-6012. So given the time, if there's no more questions coming, I think we're going to conclude. Let me say again, thank you very much, Lorraine. Thank you for this important information that we shared today with our audience. Mm-hmm. Thank you for your help in getting those folks so much better. They didn't have to the hospital to survive. We are very happy. Yeah. And we hope that people are aware that the homeopathic Without Border has been involved in Haiti and reaching out to minority and folks, and whatever we can do to support, that would be really appreciated. I hope that you and I, we can meet again and have another, since we don't have to meet now because we're physical.
I want to come and hear you play music.
Well, I'm looking forward to resume playing as well, but in the meantime, I may have to do it online, but I don't know how the people are going to pay me, but that's okay. No, I'm looking forward to that. Let me tell the folks while I have you online, I'm doing my show this coming Wednesday on alternative, complementary alternative medicine, how we can use that in dealing with our illness and our concern. Okay. So, and I will be posting this on my webpage and on my Facebook page. It's in St. Petersburg, 99.1 FM WUMG. And the website is www.99gems, JAMSTHE, the Berg, BURG.com. So, oh, okay. Let me take that one. Lori, this is for, Lori, you there? Lauren?
I'm still here, yep.
Can I take my regular medication with homeopathic medicine?
Very good question. Yes, we would homeopath wouldn't take any other medications away from the patient. Things like asthma medicines or heart medicines, blood pressure, diabetes medicines, you keep taking them. Homeopathy can work alongside allopathic medicines for sure.
Okay, this question I'll take. What is your feeling about wearing masks? Absolutely. Now, if you look at the world, the response to the coronavirus, a lot of the countries have had success really mitigating the speed of the virus, everybody from the start has been wearing masks. I think we sort of copied that to them. Not only they wear masks for this coronavirus, but traditionally for any infectious, contagious disease, they use the respirator mask. The argument is that if you are healthy, you're wearing the mask, it doesn't necessarily protect you, okay? But you don't know, because there are 25% of the people who are infected with coronavirus are totally asymptomatic. You may be talking to somebody, if you don't keep the distance and they cough and they sneeze, if they're not wearing a mask, then you're gonna get affected. So therefore, everybody wear masks. As a matter of fact, that's one of the recommendations as we move into opening our society back again. Everybody really should wear masks. Not only does it protect you, but it protects the rest of the population itself. We have to take care of each other. I totally in favor of wearing masks. Those vaccinated, there's no vaccine for COVID yet. So, as a matter of fact, no, actually, we do, in the medical field, we do recommend vaccinations to the flu. The vaccination for the flu has been there forever and actually saved a lot of lives. So, but there's no vaccine currently for the COVID-19. The government is working fast and furious to actually bring all the manufacturers in line to produce a vaccine in a short order. We just hope and pray that the vaccine do come sooner than later, but generally it does take a little time. Any other question you had? Okay, so we're going to conclude our show, and I certainly hope that this sort of format and the topics have really helped and interested you. And I appreciate your participation and the question and the interest. And really thank you. And we're going to make sure Jean-René and I and other members of our community, we're going to sit down to see how we can do this on a regular basis. Hopefully bring other people with skill that they want to change, they want to share with the community, whether it's in the field of economic, health, and others.
Good.
All right. So
Great.
Thank you very much, Lauren, again. Thank you.
You're very welcome. Take good care. Thank you both.
And also thank you, Lori, if you are listening.